the best way to do that is to effectively and efficiently roll out COVID-19 vaccines.
One of the industries which has been most severely impacted by the COVID-19 pandemic is that of tourism, as many countries have put in place very severe travel restrictions and requirements for testing, isolation, and quarantine. Here to discuss with us today is Gerbrandt van Heerden from the Centre for Risk Analysis. Gerbrandt, tell us a little bit about the importance of the tourism industry in South Africa and how it has been impacted by the pandemic.
Hello, Nick. Yes, like many other middle-income countries and emerging markets, tourism plays a vital role in South Africa's economy. In fact, tourism lobby group, the South African Tourism Organization, they stated earlier that tourism contributed 125 billion rand to South Africa's economy in 2019. And also contributed around 800,000 direct jobs. Now, World Travel and Tourism Council, in their annual review, they stated that tourism sustained at least 1.5 million livelihoods. So it's very clear that South Africa's tourism industry is a very important sector for the country. However, like many other parts of the world, South Africa's tourism industry has been one of the biggest casualties during the COVID-19 pandemic. And we've seen that with Status.a's latest data. Now, the data showed that between December 2019 and December 2020, income from the tourism accommodation sector declined by around 60%, and foreign arrivals in the country declined by around 80%. Also, South Africa's star attraction, the V&A waterfront in Cape Town, saw a drastic increase in the number of tenants being in arrears, and bad debt in the area has basically doubled between June 2020 and December 2020. So South Africa's tourism industry is definitely in dire straits. And the only way to get the sector back on its feet is to inspire confidence in the country that it has control over the pandemic. And the best way to do that is to effectively and efficiently roll out COVID-19 vaccines.
Enjoying our content? Click here for a 30-day free trial of the Centre for Risk Analysis to gain more access to our content.
Indeed, the vaccine rollout seems to be the only thing at this point that can put a proper and final end to epidemics in various countries around the world. Now, some countries have been very good in this. United Kingdom, the United States, Israel, and so on have very large quantities of their population already vaccinated. How has South Africa been in its vaccine rollout strategy?
So unfortunately, we've been really slow to act. The government initially planned to vaccinate around 40 million South Africans by 2021. And Health Minister Zweli Mkhize actually recently stated that the country is still committed to reaching that target for 2021. However, we're already going to miss our short-term target for March. The government initially planned to vaccinate around 1.5 million South Africans by the end of March. Within the first 2 weeks of March, the government has only managed to vaccinate around 150,000 South Africans. Now that's 10% of March's target. Also, a South African Medical Research Council Professor Glenda Gray stated that the country needs at least 150,000 jabs a day if we're going to meet targets. So just to put that in perspective, we are supposed to have 150,000 South Africans vaccinated daily at least, and we've only managed to do that within the first quarter of the year. So South Africa has really fared poorly in terms of the rollout of vaccines.
Yeah, well, I think we can see this for sure in comparison to a lot of other countries, and I think this is yet another case of really overestimating what is actually capable. What are some of the reasons for South Africa's slow rate in vaccination?
So there are multiple reasons. Firstly, as we all know, the 1 million AstraZeneca vaccines that we imported in the beginning of the year proved to be less effective against the new variant that was identified in South Africa. And so the government had to temporarily halt its rollout of vaccines until a more effective substitute could be obtained. However, the biggest reason for why South Africa's rollout of vaccines have been so slow is because of a series of missteps that the government has made. So, for example, in last year's medium-term budget policy statement, it was clear that the government initially did not allocate enough funds to procure enough vaccines to vaccinate at least 2/3 of the country's population. Also, in that same budget policy statement, the government once again set aside billions and billions of rand to bail out state-owned enterprises. Now that shows where the government's priorities actually lie. Also, earlier this year and last year, the government created a lot of confusion and uncertainty when they publicly made it clear that they will be the sole provider of vaccines. And that left a lot of confusion and uncertainty about what the position of the private sector is going to be during the vaccination process. We now know the private sector can actually play a more prominent role in the purchasing and distributing of vaccines. Also, the government failed to take full advantage of at least 4 COVID-19 vaccine trials that took place in South Africa. We could have used those trials to negotiate for more vaccines or to get vaccines more cheaply, and we simply did not do that. And I think what's also very disturbing is the fact that even though the government has been slow to act, they only started to act more urgently when civil society groups such as the Institute of Race Relations and more prominent scientists and health experts publicly criticized the government and threatened the government with legal action before the government actually started to act with haste and more urgency. And so that's why South Africa is going to be one of the last countries in the world to fully vaccinate its population. We have another sub-Saharan African country, the Seychelles, which plans on being the first country in the world, or one of the first countries in the world, to vaccinate at least 70% of its population. Meanwhile, here in South Africa, we've seen now 120 countries across the world who have now implemented more stricter travel restrictions to South Africa because of the concern of the second variant or the new variant here in the country. And this is really going to deal a huge blow for South Africa's tourism industry. We're not going to be looked at as a viable tourist destination for a long time because of the failure in the distribution of COVID-19 vaccines. And finally, the biggest risk in the slow vaccination rate is that a new variant might emerge that could be even more stubborn against the current vaccines that we're using.
Indeed, it really is a crisis that has gone on for a long time now, and the longer it stays here, the more damage it does. And, not just to the tourism industry, but that has a much broader knock-on effect to the rest of the country. Thank you very much, Gerbrandt, for sharing that interesting information with us. If you enjoyed this video and you like our content, please subscribe to the channel, give the video a like, leave a comment. And for more strategic risk advice, follow the link in the description to gain access to our 30-day free trial.